Burning feet at night can feel like fire under the skin, stealing away comfort and sleep. For many older adults, this painful sensation, ice and tea, just random it is often the body's way of warning that something deeper is happening. Tingling, heat, and restless discomfort may appear mild at first, but over time they can grow unbearable, leaving you exhausted each morning. If you or someone you love feels like their feet are burning every night, it's important to understand the hidden causes behind it. Once you know what's really happening, you can take steps toward relief and peaceful sleep again. Peripheral neuropathy is one of the leading causes of burning feet at night, especially in people over 50, and diabetes is one of the most common reasons this condition develops. When blood sugar levels remain high for long periods of time, the small nerves in the feet and legs begin to suffer damage. These nerves are responsible for carrying sensations like touch, temperature, and pain to the brain. Once they are weakened, the signals become mixed or distorted, and the result is a painful burning, tingling, or numbness that many seniors feel most intensely when they try to rest. Doctors explain that this happens because high glucose damages the tiny blood vessels that supply oxygen and nutrients to the nerves. Without steady circulation, the nerves slowly lose their ability to function properly. The discomfort is often worse at night because circulation naturally slows when lying down. And there are fewer distractions compared to daytime, making the burning sensations feel stronger and harder to ignore. Studies have shown that as many as half of adults with long-term diabetes experience some form of neuropathy, and the feet are almost always the first area affected. This is why specialists recommend that anyone over 60 who notices regular burning or tingling in their feet should have their blood sugar levels checked. Some doctors warn that ignoring these early warning signs can lead to more serious complications, including foot ulcers and difficulty with balance or walking. The burning caused by peripheral neuropathy is not only uncomfortable, but also emotionally draining, especially when it disrupts sleep. Restless nights make it harder for the body to heal and for blood sugar levels to remain stable, creating a cycle that worsens the condition. Many experts emphasize that managing diabetes carefully through regular checkups, healthy routines, and prescribed medications when necessary remains the best way to protect the nerves. While there is no quick fix once nerve damage has occurred, early detection and proper care can slow its progress and ease the nightly burning sensations that trouble so many older adults. Vitamin deficiencies, particularly a lack of B12, B6, and folate, are a frequent cause of burning feet in older adults. These vitamins are essential for protecting and repairing nerves, and when levels drop too low, the nerves become fragile and more prone to misfiring. This damage often shows up as tingling, burning, or pins and needles in the feet, which can become especially noticeable at night. Doctors explain that B12 plays one of the most important roles in keeping the protective coating around nerves, called the myelin sheath, strong and intact. Without it, nerve signals slow down or misfire, creating painful sensations. Folate and B6 also support nerve health by helping the body produce red blood cells and maintain healthy circulation, which ensures the nerves receive enough oxygen and nutrients. Older adults are more likely to develop these deficiencies because the body's ability to absorb vitamins from food declines with age. Certain medications, such as those for acid reflux or diabetes, can also interfere with vitamin absorption, making the problem worse. Studies have shown that low vitamin B12 levels are especially common in seniors. And untreated deficiency can lead not only to burning feet, but also to memory problems, balance issues, and fatigue. Doctors often warn that ignoring these early symptoms may allow nerve damage to progress to a point where it cannot be reversed. Recognizing burning or tingling feet as a possible sign of vitamin deficiency gives seniors a chance to seek timely evaluation and protect long-term nerve health. Poor circulation, often linked to peripheral artery disease, is another important cause of burning feet at night in older adults. This condition develops when the arteries that carry blood to the legs and feet become narrowed by plaque, a buildup of cholesterol and fatty deposits along the artery walls. When blood flow is restricted, the tissues and nerves in the feet do not receive enough oxygen and nutrients, leading to pain, heaviness, or a burning sensation that commonly worsens at rest or while lying down. Doctors explain that the discomfort often appears at night, because gravity no longer helps blood flow downward as it does during the day. With reduced circulation, the feet may feel hot or burning, while at the same time appearing cold to the touch. In some cases, seniors also experience cramping in the calves, or notice that small cuts or sores on the feet heal very slowly, which is another sign of poor circulation. Peripheral artery disease is especially common in people over 60 with a history of diabetes, smoking, or high cholesterol. Research has shown that even mild narrowing of the arteries can double the risk of painful symptoms in the legs and feet. Some doctors warn that ignoring these early signs may increase the chance of more serious complications, such as non-healing wounds or even an elevated risk of stroke or heart attack. Recognizing burning feet as a possible signal of poor circulation can help seniors seek timely medical advice and prevent further damage. Alcohol-related nerve damage, also known as alcoholic neuropathy, is a condition where long-term drinking gradually weakens and damages the peripheral nerves. These nerves are responsible for carrying signals between the brain, spinal cord, and the rest of the body. When alcohol interferes with their function, the result is often burning, tingling, or numbness in the feet that may become constant and particularly bothersome at night. Doctors explain that alcohol damages nerves in two main ways. First, it is directly toxic to nerve tissue, slowly wearing away the protective covering around the nerves. Second, heavy alcohol use often leads to poor nutrition, especially deficiencies in B vitamins, which are critical for nerve health. Together, these factors make the nerves more fragile and prone to misfiring, which creates painful sensations in the feet and legs. The symptoms of alcoholic neuropathy can closely resemble those of diabetic neuropathy, with burning, stabbing pain, or a sensation of pins and needles. Some people also report weakness in the legs or difficulty with balance. Studies show that the longer a person drinks heavily, the higher the risk of permanent nerve damage. Doctors warn that once nerves are severely damaged, they rarely heal completely, which is why early recognition of burning feet as a possible sign of alcohol-related neuropathy is so important. Chronic kidney disease can lead to a condition known as uremic neuropathy, where waste products that are normally filtered by healthy kidneys begin to build up in the blood and irritate the nerves. When this happens, many older adults notice burning, tingling, or restlessness in their feet, symptoms that often become more pronounced at night. The discomfort is caused by toxins interfering with the way nerves transmit signals, creating sensations that are painful or abnormal, even when there is no actual injury to the feet. Doctors explain that this type of nerve damage is slow to develop and may remain unnoticed until kidney function has already declined significantly, because the early stages of kidney disease can be silent. Burning feet are sometimes one of the first clues that something more serious is happening. Studies have found that patients with advanced kidney disease are particularly prone to neuropathic pain in the lower limbs, which can interfere with sleep and mobility. Some doctors warn that overlooking these symptoms can delay diagnosis and allow kidney disease to progress unchecked. Recognizing burning feet as a possible effect of uremic neuropathy gives seniors the chance to seek medical evaluation early, helping to slow further damage and protect overall health. Hypothyroidism, or low thyroid function, occurs when the thyroid gland does not produce enough hormones to keep the body's metabolism running smoothly. These hormones play an important role in regulating how the body uses energy and how nerves repair themselves. When levels are too low, the nerves may not function properly, leading to unusual sensations such as swelling, tingling, or burning in the feet. Doctors explain that the reduced hormone activity also causes tissues to retain fluid, which can put extra pressure on nerves in the legs and feet. This combination of slowed nerve repair and compression increases the chances of neuropathy-like symptoms. Many seniors with hypothyroidism notice that these sensations in their feet come alongside other issues such as persistent fatigue, unexplained weight gain, or feeling unusually sensitive to cold temperatures. Research shows that hypothyroidism often develops gradually, and its symptoms are sometimes mistaken for normal aging. Because of this, burning or tingling in the feet may be overlooked as a thyroid-related problem until other signs appear. Some doctors warn that untreated hypothyroidism not only worsens nerve discomfort but can also affect heart health and overall energy. Recognizing these subtle changes early can make a major difference in management. Nerve entrapment in the ankle, known as tarsal tunnel syndrome, occurs when the tibial nerve becomes pinched as it passes through a narrow space near the ankle. This pressure on the nerve disrupts normal signaling and often mimics the symptoms of neuropathy, making it difficult to tell the difference without proper evaluation. People commonly experience sharp, burning pain or tingling in the feet, which can radiate into the toes and sometimes up the leg. Doctors explain that the discomfort often worsens at night or after long periods of standing, when swelling increases pressure inside the tunnel. The condition is sometimes compared to carpal tunnel syndrome in the wrist, but here the trapped nerve affects the feet instead of the hands. Because the pain and numbness can resemble diabetic or vitamin deficiency-related neuropathy, tarsal tunnel syndrome is frequently overlooked. Proper recognition is important, since nerve entrapment may be treated differently than other causes of foot pain. Infections in the skin or nerves can trigger sharp burning pain in the feet, and two of the most common examples are athlete's foot and shingles. Athlete's foot is a fungal infection that develops between the toes or on the soles of the feet, leading to itching, redness, and a persistent burning sensation. It can spread quickly in warm, damp conditions such as shoes or public showers, and while it is not life-threatening, the irritation can make walking or sleeping uncomfortable. Shingles, caused by the reactivation of the chickenpox virus, often affects nerves and can leave lasting pain even after the rash heals. This lingering discomfort is known as postherpetic neuralgia and is described by many patients as burning, stabbing, or electric-like sensations. Doctors emphasize that infections like these should not be ignored, since early treatment reduces the risk of chronic nerve pain or complications. Certain medications can damage nerve endings and create painful burning sensations in the feet, a condition often referred to as drug-induced neuropathy. Chemotherapy drugs are among the most common causes, since they are designed to attack rapidly dividing cells, but may also harm delicate nerve fibers in the process. Some HIV medications and even certain antibiotics have been linked to similar effects, especially when taken over extended periods. Doctors explain that these symptoms may not appear right away. Instead, the burning, tingling, or numbness often begins weeks or even months after treatment has started, making it harder to connect the discomfort directly to the medication. Seniors are at higher risk because their bodies process drugs more slowly, which increases the likelihood of nerve toxicity during long-term therapy. Recognizing medication side effects as a possible cause is important, since adjusting treatment can sometimes relieve or reduce the nerve pain. Restless leg syndrome occurs when nerves misfire at night, creating uncomfortable sensations in the legs and feet that can feel like burning, tingling, or even a crawling movement under the skin. These sensations often become worse during periods of rest, making it especially difficult for older adults to fall asleep or stay asleep. Doctors note that this condition is commonly linked to underlying issues such as iron deficiency, diabetes, or existing nerve damage, all of which are more prevalent in seniors. The overactivity of nerves in this condition means the brain is receiving abnormal signals, which can trick the body into feeling pain or movement that isn't really happening. Because symptoms flare up most strongly at night, the quality of rest can be severely affected, leaving people fatigued and less energetic during the day. Identifying and treating the underlying cause is key to reducing the burning sensations and restoring better sleep. If you care about your health and want trusted, clear answers designed for life after 50, Make sure to subscribe and click the bell so you never miss an update. This way, each time we release new information, you'll have it at your fingertips. And if burning feet at night has ever disrupted your rest, share your experience in the comments below so others know they're not alone. Many people find comfort in hearing that someone else has gone through the same thing. And your story could be the very thing that helps another person finally seek the answers they need.